Now, the question is about patch test. Already we've answered this question a number of times, but they haven't seen the video yet. So I'll just read the question. And do you patch test on the area they want treated? Well, yes. The point is, whatever you want, whatever way you want to treat the area. Say you use the spot technique, for instance. If you use the spot technique, you want to use the spot technique as a patch testing. If you use the spray technique, you want to do the spray technique as a patch testing. Basically, the patch test is the same as you would actually carry out in your full treatment, but on a very small area. The smaller the better. Normally, it's just up to you. In theory, you are doing the patch testing, assuming the very worst case scenario, they're going to leave scars and so on, so you're going to do it in a very small area. So you're going to prove to the clients and to yourself that there's not going to be a problem with the treatment, and the treatment is not going to cause any adverse reactions. That is the main point. That is something that's has been advised. But now, we actually, just as a further note, we've done so many treatments now in the thousands now. We start to stop doing the patch testing. That doesn't mean that you shouldn't do it, especially if you start using plasma devices for aesthetic purposes. You should actually do it. Especially must propose it to your clients. If they don't want to do it, it's up to them. So whatever problem they may get, they have chosen expressly not to perform a patch test. So the patch test is for you to prove that the treatment is going to be okay. It's not going to cause any problem. And then in the very, very worst case scenario, which it doesn't really happen, if something happens, it happens in a very small area. Hopefully I've answered the question. So I'll repeat it again. When you do a patch test, you do it in the same way that you would do the full treatment, but in a very small area. That's it. So if you're, as if you're actually thinking that you're going to cause a scar or anything of the sort, so you're minimizing that. You're minimizing the area of the treatment, but you want to do this treatment in the same way that you're doing that you would do the treatment in the full area. So, for example, if you do a tattoo removal, if you want to do this salt application after a treatment, you apply the salt. Instead of being in a large area, it's going to be in a very, very small area. Hopefully that answers the question.